We know that good plaque removal is important. We also know that unfortunately a large proportion of patients achieve insufficient plaque removal, which can lead to periodontal diseases. As dental professionals, it is our role to encourage patients to improve their plaque removal by giving them the skills to do so. We recognise that it is often difficult to change a patient's oral hygiene behaviour, even if they appear willing. With this in mind, the Scottish Dental Clinical Effectiveness Programme, SDCEP, has developed a behaviour change strategy called Oral Hygiene TIPPS to assist clinicians in the prevention and treatment of periodontal diseases in primary care. Modelled on proven behaviour change strategies to improve plaque removal, OH TIPPS aims to increase the patient's confidence in their ability to perform effective plaque removal and to help them plan when to clean their teeth. Research suggests that when advice is personalised and reinforced at every visit, patients are more likely to change their behaviour. OH TIPPS is split into 5 distinct sections, but the full intervention only takes a few minutes to deliver. It is important not to lecture patients, but to be empathetic and non-judgmental when discussing plaque removal. The first stage of OH TIPPS is to talk with the patient about the causes of periodontal disease and why effective plaque removal is important.
Thank you for coming in again today. It's nice to see you. I've noticed that your gums are red, swollen, and they bleed when I touch them. Have you noticed that your gums bleed?
Yeah, I've noticed that when I spit into the basin with the toothpaste, there's blood in the basin. And when I bite an apple, there's blood on the apple too.
Healthy gums shouldn't bleed. Bleeding is a sign of gum disease, which occurs because plaque builds up on your teeth around the gum margin. Plaque is that sticky white substance you can scrape off your teeth with your fingernail. The bacteria in the plaque irritate the gums, and that's why they become red, swollen and bleed. Luckily, if you get into a good oral hygiene habit and remove the plaque from your teeth, the gums should become healthy again.
But I brush my teeth every morning anyway.
That's great that you've got into the habit of brushing every morning. How long do you brush for?
About a minute or so.
Do you think that's long enough to remove the plaque from all the tooth surfaces?
Obviously not, if my gums are still bleeding.
It's important that you're removing the plaque because otherwise the disease might get worse. You need to take longer, about 2 minutes, in order to remove the plaque from all the tooth surfaces. I noticed that you're not cleaning very well along the inside of your lower teeth and behind your last teeth at the back. These are the places where plaque has built up over time, and I can see that it's hardened into something called calculus or tartar.
Oh right, I've heard of that.
A toothbrush can't remove calculus, but I can do that for you. It's important that I remove it because plaque builds up on top of calculus.
I can't understand why I'm missing bits when I'm brushing my teeth.
How long is it since you changed your toothbrush?
About a year ago.
You need to change your toothbrush every 2 to 3 months, or when it appears worn, because after this time it becomes less effective.
Really? That's good to know.
While you're here, why don't I show you how best to remove the plaque from your teeth?
I feel a bit daft needing to be taught how to brush my teeth at my age.
That's understandable, but please don't feel embarrassed. Many people have to be shown how to clean their teeth properly. It's important that you're removing the plaque from all the tooth surfaces, especially along the gum line. If you don't remove the plaque, the disease may get worse.
Okay, I suppose you're right.
So I can show you how to brush one side of your mouth, and then you can brush the other side. And we can use a mirror so that you can see exactly what I'm doing.
The second step is to instruct the patient in the use of plaque removal tools. It is important that patients look in a mirror and that those who wear spectacles all the time or for reading wear them while cleaning their teeth.
The most important thing about cleaning your teeth is that you're methodical about it and you make sure that you clean all the surfaces. The toothbrush can clean the cheek sides, the tongue sides and the biting surfaces, and it should take you about 2 minutes to clean them properly. Let me just have a look, John, here. This is a common place where people build up plaque on the inside of their lower teeth. And you can see on the probe that tiny little blob of plaque contains millions of bacteria. So we've got to make sure that you remove all the plaque from all the surfaces of your teeth. So I'm just going to show you now how to brush your teeth, okay? Now, you need to start right up at the back here and you need to have the toothbrush half on the gum and half on the tooth. And I'm doing 8 to 10 strokes backwards and forwards before moving on to the next section. Okay? And then when you're doing the inside of the upper teeth, you need to make sure that when you get to the front here, it's sometimes easier to turn the brush round in order to clean these front ones thoroughly. In the lower jaw, it's very important that you push the tongue out of the way and make sure that you're getting the brush onto the inside of the lower teeth effectively. Okay, how does that feel now? Does that feel different from the way you normally brush your teeth?
Not really, but you're spending much more time on each individual tooth, especially the back ones.
If a patient uses an electric toothbrush or switches from a manual toothbrush to an electric toothbrush, it is important to advise against a scrubbing technique. Explain that the electric toothbrush does the work for the patient if held in the correct position. The next step is to ask the patient to practice, i.e. to clean his or her teeth in front of you.
John, you're brushing a bit too hard and a bit too fast. You really need to do a short scrubbing action, just covering a few teeth. And have a look in the mirror while you're doing it. Yes, that's better. Now, you haven't really got the brush head into the right place on the inside. Would you mind if I just guided your hand into the right position?
Okay.
Right, you need the brush to be, if you just look in the mirror now, to be half on the gum and half on the tooth. The tongue is a very strong muscle and it tends to push the brush head out of the way. That's better. So how does that feel? Do your teeth feel cleaner now?
Yes, they do. They feel really smooth, and I've spent a lot more time on them than I normally would. I can taste blood.
Yes, the reason you can taste blood is because your gums are still inflamed. But if you keep brushing like that, the bleeding will go away and your gums will become healthy again.
It is important to confirm that patients feel confident about removing plaque from their teeth effectively. Some patients take longer than others to master the correct technique, and repeated demonstration and encouragement is required from the clinician at subsequent visits. Next, you need to help the patient make effective plaque removal a habit with the right plan.
So I have to do this twice a day?
Yes, that's right. When do you think you could fit tooth cleaning into your day and make it a habit?
As I say, I already clean my teeth first thing in the morning. So if I try it at night as well.
That would be great. Last thing at night is a really good time to clean your teeth. And make sure when you've brushed your teeth that you don't eat or drink anything afterwards apart from water. You should use a fluoride toothpaste and only spit out, don't rinse out with anything.
So if I clean my teeth first thing in the morning and at night, then my gums will stop bleeding?
Yes, they should. They should go back to normal.
The final OH tip step is to ensure you support the patient to achieve effective plaque removal by following up on the advice at the next appointment.
There are other things you can use to clean in between your teeth. Do you use floss at all?
Only when there's something stuck in my teeth. It's fiddly and I can't see the benefit.
Well, plaque can build up between your teeth which you can't reach with a toothbrush. I know it's fiddly to use floss, but the next time you come in, I could show you how to use it properly. How does that sound?
Okay.
Great. Well, I'll look forward to seeing you at your next visit, and I'm sure by then your gums will be looking better. It's important to encourage patients to improve their plaque removal because a large proportion of the population is affected by periodontal diseases. Prevention and treatment of these diseases relies on the ability and willingness of the patient to perform and maintain effective plaque removal. This may require a change in the patient's oral hygiene behaviour. We know it can be difficult to change a patient's oral hygiene behaviour. OH TIPPS is designed to help clinicians raise the issue with patients and to give them the skills needed to adequately care for their teeth and gums. It also gives patients the confidence to plan how and when they will build plaque removal into their day.
Oral Hygiene TIPPS has been developed to help facilitate an ongoing discussion with patients in order to improve their oral hygiene behaviours. taking the time to discuss and to demonstrate effective plaque removal techniques is likely to lead to improvements in oral health and a reduction in periodontal diseases, which is good for the patient and good for you. So you could say it's smiles all round.